Okay, so next we're going to talk about hepatitis. So there are many different types of hepatitis. We're going to focus just on A, B, and C, and some non-viral causes of hepatitis as well. So hepatitis, anytime you see itis, is going to be inflammation of. So hepatitis is going to be inflammation of the liver. And so some viral causes of hepatitis include hepatitis A. Hepatitis A is actually foodborne. So you can actually contract hepatitis A from improperly prepared foods. So shellfish, that have that particular virus can cause you to have hepatitis A. Hepatitis B is bloodborne, which can cause inflammation that leads to cirrhosis. So hepatitis B, there is a vaccine for it. So vaccine is given to newborns and anybody who's working in a hospital. So there is a vaccine which makes hepatitis B preventable, but there is no cure for hepatitis B if you do have it. Now, most adults will recover from hepatitis B. It's called acute hepatitis B, but sometimes it can become chronic, and when that happens, it can lead to inflammation of the liver hepatitis, and then can lead to cirrhosis. And when that kind of snowball starts, it can actually kill that person pretty quickly. And infants are going to be more susceptible to having the chronic version of hepatitis B, which is why it's really important for babies and those who work in a hospital setting to be vaccinated for hepatitis B, because it is preventable but not curable. So it can be transported or can be transmitted through blood and also semen and other bodily fluids as well. Hepatitis C, though, is actually the most important infectious liver disease. It is bloodborne. It's slower, so it doesn't kill as fast, but it actually kills a lot of people. So 4 million Americans are affected by hepatitis C, and about 10,000 people die annually from hepatitis C. But the inflammation that it causes will lead to cirrhosis. So here's a normal liver here, and then a cirrhotic liver. So you can see all the inflammation that's occurring on these little bubbles that occur on the outside of and on the inside of the liver here. So that's a cirrhotic liver, and then it can get even worse and cause lots of fibrosis and end-stage liver disease. Treatment for this would be a liver transplant, but liver transplants are very hard to come by. And you can actually be treated for hepatitis C. There's like a 12-week drug therapy that you can take to get past this infection. However, it's really, really expensive. For a 12-week treatment, you're looking at anywhere from $40,000 to over $90,000 for a 12-week treatment for hepatitis C. So very, 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 very expensive. But yeah, this is the most important infectious liver disease, hepatitis C. Some non-viral causes for hepatitis for inflammation of the liver include alcohol. So because if you take a lot of excessive alcohol, you're putting a lot of, you're overwhelming the liver, because the liver is there to detoxify. But if you're constantly giving it alcohol, constantly giving it a toxic material, it's not going to be able to detoxify that blood fast enough. And that toxin, that alcohol, is going to end up damaging the liver in the process and causing inflammation. And a lot of times it's going to cause, because the alcohol gets converted into aldehyde, which converts into sugar. And if we have excess sugar, it gets converted to fat. You'll get lots of fatty deposits on the liver for that reason as well. You can also have hepatotoxic chemicals, so chemicals that are toxic to the liver. That's what hepatotoxic means. So chemicals that are toxic to the liver, hepatotoxic. But there are many different chemicals that can be toxic to the liver that will cause hepatitis. That includes pain relievers. So if you're taking pain relievers long-term, it can cause hepatitis, especially if it's paired with alcohol. Prescription meds like antivirals, and which are a lot of times steroids, and anabolic steroids as well, can lead to hepatitis, because that's just a lot. Any one of these things, you're overwhelming the liver, so its job is for detoxification. But if you're constantly overwhelming it with toxins, it's going to end up causing more damage than because the liver is not going to be able to handle all the toxins that you're bringing into it. Certain supplements can also be toxic to the liver. And then as well as workplace toxins. So dry cleaning solvent, a certain chemical in dry cleaning solvent can be toxic to the liver, as well as chemicals that are used to make plastics can also lead to hepatitis, as well as herbicides and other industrial products can lead to hepatitis if you're exposed to them long term. So when you do have this hepatitis, okay, this inflammation of the liver that eventually leads to cirrhosis, okay, it can look like this, really fatty, lots of inflammation, and it's like twice the size of a regular liver. So this would be a normal, healthy liver here, and this would be a cirrhotic liver over here. So lots of damage that can be caused either through viral infection, through alcohol intake, excessive alcohol intake, or different chemicals that you are possibly either willfully ingesting or you could be exposed to, like in the workplace. One side effect of cirrhosis or a symptom of cirrhosis, or actually this would be not a symptom, this would be a sign because it's an outward appearance. It's something that could be verified by a medical professional. So this would be a sign, but it's something called ascites. So ascites is when you have fluid in your peritoneal cavity. And the reason for that is if you have lots of fibrosis that's occurring, so you see all this damage that's happening on this liver. So if you have all this fibrosis that's occurring, that means that that's going to be a lot of connective tissue and not a whole lot of healthy liver tissue. And one of the functions of your liver is to produce a protein called albumin. And remember, albumin is what maintains the water levels in the blood. So if you don't have enough albumin in the blood that's attracting water into the blood, that water needs somewhere to go. That water is going to end up staying in your peritoneal cavity or leaking into your peritoneal cavity. So you have all this fluid buildup called ascites. And again, that's because your liver is fibrosed. So there's not enough healthy hepatocytes, which means those hepatocytes are not making enough albumin. And your albumin is the protein that attracts water to your blood. So if your water is not in your blood where it should, it's going to have to go somewhere. And many times it's going to fill up that peritoneal cavity and cause ascites. Okay, so that's a fluid buildup in the peritoneal cavity. So this is a normal person without ascites. That's what their abdominal cavity looks like. But when you have ascites, because you're not producing enough albumin, you can have that fluid buildup. Sorry, guys, I'm trying to get through this. Okay, another cause for ascites is malnutrition. So children who live in third world countries who are not getting enough protein. So a lot of times in these third world countries, in these villages and such, these children are usually dependent on some kind of agricultural a product, like whether one big thing is like potatoes. So that village may grow a lot of potatoes, which is just carbohydrates. It's not protein. So if children are not getting enough protein, that means that their body isn't breaking down enough protein, so they don't have enough amino acids in their blood to build up all the proper proteins. One of those proper proteins is albumin. So if you're not taking in enough protein, then you're not going to have enough amino acids to build the albumin, so you don't have enough albumin in your blood to attract water to the blood. So then that fluid ends up in that water ends up building up in the abdomen. So that's why you get these large tummies in these areas where the children are malnourished, and that's just because of a lack of protein in the diet. So if you don't have protein, you don't have amino acids, and those amino acids are needed to build the proper proteins inside the body, one of them being albumin that keeps that water in the blood and not in the peritoneal cavity. So another consequence of cirrhosis is also what's called hepatic portal hypertension. So what happens is when you have lots of fibrosis in the liver, that means that not enough blood is able to get through deliver fast enough because you still have enough healthy tissue. So the blood ends up backing up into the hepatic portal vein because your liver isn't healthy enough to take an adequate amount of blood through to detoxify and then deliver up the inferior vena cava back to the heart. So very little blood is getting through the liver and returning through the hepatic veins, again, just because the liver is damaged. So then you have a backup of blood in the hepatic portal veins and the veins leading to the hepatic portal vein. And many times what can happen, and because of this backing up, it's going to cause varicosities. So if you remember when we talked about varicose veins in the legs, because of the pooling of blood, this is a similar effect that's happening in the abdomen because not enough blood is getting filtered out through the liver. So you have a backing up of blood in the hepatic portal vein and the veins leading to the hepatic portal vein, which is going to cause hypertension. So those veins are going to be stretched, and sometimes they'll burst. And when that happens, you can end up with vomit, blood in your vomit, or even blood in your stool due to cirrhosis, which caused the hypertension, which caused a bursting of those vessels, which then eventually led to the vomit in the blood and the stool. So the cause would have been the cirrhosis ultimately, but the cirrhosis caused the hypertension, which caused the bursting, which caused the blood to be able to leak out into the vomit or into the stool. Okay, but the ultimate cause would have been cirrhosis. So here you can see these varicosities. So these bulging of the veins from the hepatic portal. So this hepatic portal hypertension, because again, there's just not enough blood that's going through the liver to be filtered because of all the fibrosis and damage and inflammation. Okay, I'm gonna stop here and we'll talk about the gallbladder and the pancreas next.